Extinction and Differential Reinforcement by Catherine Saint. The research question for this study is, what are the effects of differential reinforcement of alternative behavior combined with extinction on problem behavior in children in the in-home setting? The first problem to look at is extinction bursts. Extinction causes extinction bursts and happens in 60% of cases where extinction is used alone. The simplest solution would be to not use extinction, but this is not the best option because procedures to address problem behaviors without the use of extinction are proven to be less effective. So a solution is needed for this. The second problem to look at is extinction bursts and the effects it has on caregivers. Problem behaviors intensify, and caregivers often will end the intervention. Extinction bursts are punishing to caregivers by increasing intensity, duration, or frequency. This causes the caregivers to not complete the intervention or to decrease their consistency. The great news is that there's a solution. Differential reinforcement combined with extinction can reduce the punishing effects of extinction. Lerman, Iwata, and Wallace found that extinction bursts happen in 20% of cases when extinction is implemented with differential reinforcement. This is a 40% reduction. To further the research on this concept, this study replicated an adaptive version of Mazowski, Iwata, Vollmer, Zarcone, and Smith. In their study, 3 women with developmental disabilities had self-injurious behaviors. They used DRO and extinction to reduce the self-injurious behavior, and they experienced no extinction bursts. This is the advertisement that was used to recruit participants to the study. The research method used was a multi-element design across 3 children in the in-home setting. Reversal would not have been ethical given the area of study. Crying was the target behavior. A functional behavior assessment was done with each child to determine the function. Problem behaviors with the function of attention were selected. The problem target behavior and the replacement behavior was measured with partial interval recording. A second observer collected data 30% of the time to ensure an IOA of 80% or higher. Interval by interval IOA was used to measure IOA. The dependent variable was the frequency of the problem behavior after the intervention. Baseline on the problem behavior and replacement behavior was taken before the intervention. Focus was on if the behavior displayed an extinction burst and if the behavior is reduced. To increase integrity, checklists were made on the steps of the procedure. The results indicated that no extinction bursts occurred. All of the participants reduced crying to age-appropriate levels. All of the participants increased communication to age-appropriate levels as well. 2 or 3 weeks after the study, the caregivers reported that behaviors were maintaining at age-appropriate levels. The study had an IOA of 88% and treatment integrity of 96%. Here is the data displaying the results of the study. Extinction is an evidence-based procedure that is highly effective in reducing problem behaviors. It can have punishing effects, but this study helps to prove that there are ways that can reduce those punishing effects and increase treatment integrity. This research gives generality to those procedures. Caregiver follow-through is a key element in treatment success. Reducing punishing effects of treatment will increase treatment follow-through and success. Future areas of research include caregiver performance of treatment procedures. This research could focus on strategies to increase follow-through and understanding of the specific steps of the procedures. Different populations, such as different age groups with diagnoses, and different target behaviors, such as extreme violence, would be a good way to show the generality of the combination of these procedures. An additional area to study would be the impact of indirect prompting during extinction. This type of study could aim to learn if it reduces the effectiveness of extinction if caregivers indirectly prompt a child while performing extinction. In conclusion, differential reinforcement of alternative behavior combined with extinction was effective in reducing problem behavior and increasing communication. No extinction burst occurred.